Good day, sir. I am your student nurse Maramar Cabigas from BSN 1C. And this is my video presentation with third demonstration in assessing the musculoskeletal system of my patient. The purpose of this assessment is to establish baseline data for subsequent evaluation. For the equipment that we will be using for the assessment, we will be using a goniometer and a tape measure. For the performance, prior to performing the procedure, introduce self and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can participate. Discuss how the result will be used in planning further care or treatments. Okay, good afternoon, ma'am. I am Maramar Cabigas and I will be your nurse for today. May I know about your full name, ma'am?
My name is Agnes Cabigas.
When is your birthday?
October 29, 1968.
Your age?
I'm 52.
Okay, so the procedure that I will be doing, ma'am, is that I am going to check and observe your muscles, your bones, and your joints. So this is done for us to know if there is any abnormalities that is present to your musculoskeletal system. Would that be okay with you?
Sure, madam.
Perform hand hygiene and observe appropriate infection control procedure and provide for a client privacy. Okay, all the doors and all the curtains, ma'am, are now closed to ensure your privacy.
Okay.
Inquire if the client has any history of the following, such as a muscle pain, the onset, the location, the character, the associated phenomena, for example, the redness and the swelling of joints, the aggravating and alleviating factors, the limitations of movement or inability to perform activities of a daily living, previous sports injuries and loss of function without pain. Okay, ma'am, so I'm going to ask you questions and I promise that all information that I've gotten from you will remain confidential, okay?
Sure.
Okay, so do you feel pain or stiffness into your arms, into your back, and to your thighs?
No.
Okay, so can you walk up and down stairs without any difficulties?
Yes.
Okay, so can you dress yourself in everyday clothes without any difficulties, ma'am?
Yes.
Okay. So in a few minutes, ma'am, we're going to start, okay?
Sure.
So let's now proceed to assessing the muscles of my patient. So first, we need to inspect for the muscle size. Compare the muscles on the other side of the body, the arms, thighs, and calf, to the same muscles on the other side. Okay, so I'm going to inspect your muscles for size. Okay. Can you stand up for me, ma'am? Okay, so you have an equal size on both sides of your body, which is actually normal. For any discrepancies, measure the muscles with the tape. Inspect the muscles and tendons for contractures. Okay, ma'am, next I am going to inspect the muscles for contractures. Okay, so I don't see any contractures, ma'am. Okay. Inspect the muscles for tremors. For example, by having the client to hold the arms out in front of the body. Okay, ma'am, so I'm going to inspect the muscles for tremors. So I want you to do this. Okay, so there is no shaking, no fasciculations, and no tremors. Okay. Test muscle strength. Compare the right side with the left side. For the sternocleidomastoid, the client turns the head on the one side against the resistance of your hand. Repeat with the other side. Okay, ma'am, the next that I am going to do is that I am going to test your muscle strength. So the muscle strength should be equal bilaterally and fully resist your opposing force, okay? Okay, so can you sit for me, mom? Okay, thank you. Okay, mom, so the first that I am going to check is your sternocleidomastoid. So I want you to look at your right. Look at your left. Look up. And look down. Okay, so we can also have them to do that against resistance. Okay, very good. For the trapezius, the client shrugs the shoulders against the resistance of your hands. Okay, ma'am, for your trapezius, can you shrug your shoulder for me? Okay. Okay, thank you. For the deltoid, the client holds arm up and resists while you try to push it down. Okay, ma'am, can you please raise your arms? Okay. For the biceps, the client fully extends each arms and tries to flex it while you attempt to hold arms in extension. Okay, ma'am, next I am going to check for your biceps. So can you stand up for me? Okay, so I am going to attempt to hold your arms in extension. Okay, so can you flex your arm? Okay, I'll go over the other side. Okay. For the triceps, the client flexes each arm and then tries to extend it against your attempt to keep arm in flexion. Okay, next, mom, is for your triceps. So I'm going to keep your arm in flexion. So can you flex your arm again for me, mom? Okay. Okay, I go over the other side. Flex your arm. For the wrist and finger muscles, the client spreads the fingers and resists as you attempt to push the fingers together. Okay, next, mom, is for your wrist and your finger muscles. So can you spread your fingers for me? Okay. Okay, for your palms, mom. Very good. For the grip strength, the client grasps your index and your middle finger while you try to pull the fingers out. Okay, mom, you may now sit. Okay, so for your grip strength, mom, I want you to grasp my index and my middle finger while I'm trying to pull the fingers out. Okay?
Okay.
Okay, at the other side. Okay. For the hip muscles, the client is supine. Both legs extended. The client raises one leg at a time while you attempt to hold it down. Okay, mom, next is for your hip muscles. So I want you to lay down for me. Okay, mom, can you raise your one leg and I'm going to attempt to hold it down, okay? Okay. I'll go over the other side. Can you raise your one leg? For the hip abduction, the client is supine. Both legs extended. Place your hands on the lateral surface of each knee and then the client spreads the legs apart against your resistance. Okay, mom, next is for your hip abduction. So I'm going to place my hands on the lateral surface of each knee, and you're going to spread your legs against my resistance, okay?
Okay.
Okay, so try to spread your legs, ma'am. Okay, at the other side, try to spread. Okay. For the hip adduction, the client is in the same position as for the hip abduction. Place your hands between the knees, and then the client bring the legs together against your resistance. Okay, next, mom, is for your hip adduction. So I am going to place my hands between your knees, and you're going to bring your legs together against my resistance, okay?
Okay.
Okay, try to bring it together. Okay, at the other side. Okay. For the hamstring, the client is supine, both knees bent. The client resists while you attempt to straighten the legs. Okay, mom, next is for your hamstring. So can you bend your knees for me? Okay, so I'm going to attempt to straighten your legs, okay?
Okay.
Okay. For the quadriceps, the client is supine, knee partially extended, and the client will resist while you attempt to flex the knees. Okay, ma'am, so for your quadriceps, I want you to extend your knees for me. Okay, so I'm going to attempt to flex your knees, okay?
Okay.
Okay. For the muscles of ankles and foot, the client resists when you attempt to dorsiflex the foot, and again resist when you attempt to flex the foot. Okay, next, mom, is for the muscles of your ankles and feet. Okay. Okay, the other side. Okay. 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 So let's now proceed in assessing the bones of my patient. So first, we need to inspect the skeleton for structure. Okay, ma'am, next is that I'm going to inspect your skeletons for structures. So can you sit for me, ma'am? Okay. Okay, so can you stand up for me? Okay, so I can't see any deformities, ma'am, which is nice. Next is we have to palpate the bones to locate any areas of edema or tenderness. Okay, ma'am, next I am going to palpate your bones to locate any areas of edema or tenderness. Okay, so I'm going to palpate and tell me if you feel any pain, okay?
Okay.
Okay. Do you feel pain or any tenderness, ma'am?
No.
Okay. Okay, so there's no swelling and no tenderness. Okay, ma'am. Next, I am going to palpate to locate any areas of the edema. Okay?
Okay.
Okay, ma'am. So I'm going to palpate it. Okay, do you feel pain?
No.
Okay, the other side. Do you feel pain, ma'am?
No.
Okay, so there's no swelling, no tenderness, and no signs for the edema. Let's now proceed in assessing the joints. Inspect the joints for swelling. You have to palpate each joint for tenderness, smoothness of movement, swelling, crepitation, and the presence of nodules. Okay, ma'am. Next, I am going to inspect and palpate your joints for any swelling, tenderness, crepitating, or nodules. Okay?
Okay.
Okay. So I can see any swelling to your upper extremities. I'm going down to your lower extremities. Okay. No tenderness, no crepitating, and no nodules. And your joints move smoothly. Okay. Assess joint range of motion. Ask the client to move selected body parts. The amount of joint movement can be measured by a goniometer, a device that can measure the angle of the joint in degrees. Okay, ma'am. Next, I am going to assess your joint range of motion. So first, your neck range of motion. So I want you to move your head at your right, at your left, look up, and down. Okay, so can you move your head laterally on your left and to your right shoulders? Okay, so for your rotation, ma'am, can you move your head as far as possible to your left and to your right? Okay, ma'am. So next is for your arm range of motion. So what I want you to do, ma'am, is follow what I do. Okay?
Okay.
So can you stand up for me? Okay, so can you lift your arms over your head and down at your side and put them behind your head and at your back, at your shoulder, same shoulder, and bring your arms at your side, bring your elbows back, and keep your arms straight and back again. Palms down, palms up, wrist up, wrist down, spread your fingers, and make a fist. Okay, very good. Okay, ma'am, next is for your trunk range of motion. So, can you bend forward for me, ma'am? Okay, bend back. Okay, very good. So, can you bend at your side? Okay, the other side. Okay. So, for your trunk rotation, ma'am, can you move the upper part of your body to the other side? Okay. Okay, very good. Okay, ma'am. So, the first thing that I am going to do is that I am going to lift your leg up and your knees towards your chest. And bring back again to the belly. Okay, so I'm going to do this 3 times, okay?
Okay.
1, 2, do you feel pain? 3. Okay, pag go on the other side, going to lift and your knees towards your chest. 1, 2, do you feel pain?
No.
3. Okay.
Okay, ma'am, for the next one, I am going to bring your leg out to the side and back in. Okay?
Okay.
Okay, ma'am. So I am going to do this 3 times. Okay?
Okay.
1, 2. Do you feel pain? 3. Okay, I'll go over the other side. 1, 2. Do you feel pain, ma'am?
No.
3. Okay. Okay, ma'am. Next, I am going to roll your leg in and out. Okay?
Okay.
I'm going to do this 3 times also. Okay, so 1, 2, 3. Okay, do you feel pain?
No.
Okay, at the other side. 1, 2, 3. Okay, ma'am, do you feel pain?
No.
Next, ma'am, for your ankle, I am going to move your ankle up and down. Okay, so I'm going to do this 3 times. Okay?
Okay.
1, 2, 3. Okay, and the other side. 1, 2, 3. Okay. Okay, ma'am, for the next one, I am going to turn your foot in and out. Okay? So I'm going to do this 3 times.
Okay.
Okay. 1. You feel pain?
No.
2, 3. Okay, I'll go at the other side. 1, 2, 3. Okay. Okay, ma'am, for the last one, I'm going to twirl your ankle, okay?
Okay.
Okay, so I'm going to twirl it 3 times. 1, 2, 3. Okay, on the other side. 1, 2, 3. Okay.
Now, we can now document the findings of the client's record using a form or checklist supplemented by a narrative report if appropriate. For the evaluation, perform a detailed follow-up examination on the other systems based on the findings deviated from the expected or the normal to the client. Relate the findings on the previous assessment data if available. And last, report the deviations from the expected or the normal findings to the primary care provider.